My guest today discovered how much better healthcare can be if you get primary care right first. He's the vice president of his family's lumber business and has a consulting practice focused on employee safety. Last week, I read his blog post about choosing the right doctor, and I thought, I gotta have him on the show, starting right now. Eric Brown, welcome to the show.
Well, it's good to be here. So glad to be here with you today, Hunter.
Well, I think I was looking through Twitter, and Dr. Douglas Farrago had a tweet with this tweet to a blog post, and I saw the title, and it was "Having the Wrong Doctor May Be Killing You." I thought, well, I'm clicking on this. So I thought, wow, that caught my eye. And I read about 3 paragraphs and I said, oh, I have to have him on the show.
Okay.
But did you wake up one morning and decide, I'm going to write an article for my blog about how having the wrong doctor may be killing you? How did that work? What sparked this?
Actually, you hit the nail on the head. I do most of my writing in the morning, actually quite early. We're pretty busy with the lumber business and everything that we do, long work days. So I do most of my writing early in the morning, and I did wake up one morning and I wasn't out of bed yet, and I looked for articles where I can give, not just articles about my expertise, but articles where I can give to people that impact my life in a very positive way. And with COVID and everything going on, I said, I'm going to write an article about Dr. Farrago. And you try to choose a title that's catchy and that has truth in it also. So that's where they came from.
Well, let's back up a moment. I'd like to know a little bit more about the care you had before you discovered direct primary care.
Okay. Fortunately, I've been very healthy. Didn't go to the doctor a lot. I had some in my late 30s. I got quite heavy and wasn't as healthy. And then my mother, unfortunately, died of a heart attack at the age of 59. And that prompted me to get healthier. And I began to run and exercise and take more responsibility for my health.
Sure.
And that I did pretty well up until that started in 2007, 2008. Did pretty well up until about 2016. And in 2016, I didn't go to the doctor much, but I got to an age, I need a yearly physical. I need a relationship with a primary care doctor. And I'd gone to the doctor probably once a year for the previous, 5, 6 years. Sometimes I'd go a couple of years without going to the doctor. And it became, I go to the doctor, and because I didn't go that often, I would have 3 things I'd want to talk to the doctor about. And, unfortunately, our doctors are trapped in different systems. I'd see the doctor about 3 or 4 minutes, 5 minutes. And before I could go, hey, doc, I got this other, they're gone. And so my wife and I, that's kind of the care. And usually it would be half a day to go to the doctor. It's going to sit in the waiting room 2 or 3 hours, in the exam room 30 minutes, 45 minutes, waiting to see the doctor for 5 minutes. So that's kind of my experience before direct primary care.
Well, I saw something in your article, in your blog post, and I have it in front of me. I'll put it on the screen. You said, I knew my health had plateaued. Sure, I was healthier than most people my age, but my goal is longevity with high strength and energy. After doing some research, I found a direct primary care doctor in our area. Eric Brown, what were your benchmarks for care? I mean, it's the fact that you did the research. And
Yeah.
a lot of people get into it and they just find, I have to find another doctor.
Sure,
But
sure.
somehow, some way, you wound up at direct primary care. So I'm interested in hearing you unpack that a little bit.
Yeah, that it's a really neat story how that came about. So my wife and I have been talking. We need a primary care doctor, and we weren't, happy with a lot of our options. And we are members of a Christian healthcare sharing network. I wanted to make sure I got the name right. It's SamaritansMinistries.org. And they send out a newsletter called the Christian Healthcare Newsletter. And as I thought back preparing for today, I read an article about direct primary care in their newsletter, and then that they mentioned websites. And so I went to basically every direct primary care website they mentioned, then Googled and searched, and really, which ultimately led me, we live in a rural area. It led me to that, do we have any locally? And that's where I found Dr. Farrago at Forest Direct Primary Care. The big challenge for me is how am I going to convince my wife? Because it wasn't a model we were familiar with, and paying your doctor every month, even if you don't go. So I was kind of really worried, but I did my homework and I presented it to her. And she said, that sounds like a great idea, which surprised me. Should have been more confident there.
Good for you. Well, you found Dr. Farrago. How do you pronounce it?
Farrago, Dr. Farrago.
Dr. Farrago. So you found Doug.
Doug, yeah, we'll call him Doug.
We'll call him Doug. So you found Dr. Farrago, and you walked into the clinic for the first time. And I've asked doctors, what's it like having your first patient walk through the door? And
yes,
now it's flipped. So you're a patient. So what was it like the first time you walked through the door of his clinic?
It was peaceful. It was like going home to a peaceful home. I'll sometimes compare and contrast is good. My last primary care experience before Dr. Farrago was probably 35 people in a waiting room, multiple staff, just moving around, interacting, behind glass. Nice people, good people, nothing wrong, but kind of hectic, I would say. And rightfully so. They're trying to take care of a lot of people.
Sure.
But for me, and you're sitting in there for, I think in that case, I sat in there 3 hours before I got back. I mean, it was a long day. So I go to Dr. Farrago's office. First thing I walk in is it's very professional, but the environment is for me. It's they're creating an environment where I could be comfortable, welcoming, and I was fully prepared to sit there for half hour, 45 minutes. I didn't understand, like, I'm going to, and Dr. Farrago had to tell people in emails, you don't have to get here early, just get here on time. Because I'm thinking I'm going to be there a long time. But I go in and they're ready for me. They're relaxed. That's one of the big things. They're relaxed. Christine, she's relaxed. Dr. Farrago, I didn't see his wife the first time, but when I'm there and she's there, she's relaxed. They're ready for you. They run on schedule. It was just wonderful. Just wonderful. I can't say enough good things.
Totally. It is totally different. You, as you signed up for direct primary care, one of the things that I've found in doing research about it is that a lot of people get to a point where they say, "Oh, this sounds great, but I'm already paying for insurance. Why on earth would I want to pay a membership fee? So I'm paying for primary care twice."
Right.
And I know the answer to that question pretty well now, but I'd love for you as a patient who's gone through the process, what would you say to
Sure.
someone who's looking at the same situation? They're comparing notes and they're saying, well, I have primary care through insurance, and then I have direct primary care and this membership fee. How would you coach them? What would you say to coach them to overcome this barrier in their head? Because that's been instilled in them for a long time.
Yeah, it's well, for some people, there's multiple scenarios. For some people, how valuable is your time?
Yes.
You know, if you go to the doctor 4 times a year and it's going to cost you 2 missed days of work, you've got to factor that in. That's a factor. How valuable is your time? How valuable is your health? How valuable is your mental health?
Absolutely.
These are all very important things. For a family with young children, my sister's a single mom, and she's also part of the practice, a member of the practice, Dr. Farrago's. I think about how our lives would have been different. We had mom and dad and 5 children, and no insurance. Some of those years were pretty tough, and my parents spent a lot of money taking us to the doctor. I think about how different life would have been if we'd have had a Forest Direct primary care, if we'd have had a Dr. Farrago. I know it would have made economic sense for my parents because it was me and 4 little sisters, and
Wow.
something was always going on.
Yeah. Yeah. Did you have any other reservations? I mean, were there other concerns you had before signing up, or was that the only, was that even a consideration?
What were my considerations? That's a good question. The money seemed to me a lot of value for the money, to be honest with you. Yeah, $125 is significant, or can be significant. But when I think about, one of the things I think about are people I know who unfortunately have addictions. What does a cigarette addiction cost? What does an alcohol addiction cost? In this case, I have an addiction to health. I like to be healthy.
Good.
And 125 for my wife and me, $125. Now, Dr. Farrago over 4 years has gone up to $135 a month. Wow. You know, he probably needs to raise his prices more often. I hate to say that as a patient, but I think it's true. You know, get used to incremental. His costs go up for sure. But how much do you want to spend to be healthy? So yeah, the money, yeah, it was significant, but it wasn't the factor for me. The factor for me primarily was, at that point, I'm moving towards 50 years old. I want to be healthy. I want to continue to be healthy, and I know we've got some work to do. I have a big family history of heart disease and stroke, and also I had just lost a sister to cancer. So health was at the forefront of my mind. So that's a big part of the story too.
Sure. Sure. Well, you touched on something there that just having reassurance. You know, I mean, you've got a doctor there that can handle your situation.
Sure.
One of the biggest benefits, well, there's two really big benefits to direct primary care. And when I say these things, the audience is going to see your reaction. And there's a knowing smile there. Timely access to care and time with the patient equals far better care. And you mentioned some things
Sure.
about family history,
Hmm.
and people are used to that 4 minute, 8 minute doctor visit, and you can't possibly go through and unpack all those things. You also mentioned friends or people you know that have, addiction problems. I had Dr. Molly
Hmm.
Rutherford on the show, and we talked. She's an addiction specialist, or she has an
Hmm.
addiction clinic alongside her direct primary care practice. And the fact
Sure.
that it's direct primary care enables her to do a much better job in her addiction practice because the clock isn't always ticking and it's not fee for service. So
Mm-hmm.
you have timely access to care and you have a doctor who has time to listen to you while you're sitting in front of him.
Hmm.
But I would also say he's also thinking about you when you're not sitting in front of him. He's looking at the notes. He's looking at your diet, your
Yeah.
exercise. And I say this because that's what my doctor did here in Panama. He's direct primary care. So it's not just paying them for the time you're sitting in front of them. You're paying them to be the quarterback for your care. So
Hmm. Yes.
how does that benefit you, Eric Brown? How does that make you feel?
Yeah. Well, my doctor has time because of the way he manages his life, and he's busy. I'm sure. I can't imagine how busy he is, and the calls and the emails. Uh, but because of the number of patients he has in his practice, he can. When I get there, he's ready for me when I get there.
Mm-hmm.
So he has enough time between patients to review my situation. And with fewer patients, he knows me better, I would say. So when I get there, he's ready for me. Timely access is important at the time. I would say the last I had blood work, and because of the family history, and I have a wonderful thing called lipoprotein A. It's a genetic. There's nothing you can do for it. It puts you at a little greater risk. And so we discuss things. And so we'll spend 20 minutes going over blood work and numbers and where I'm improving and where I need to improve. So it is. So the thing too I love is Dr. Farrago, you can tell, is always learning, always growing. Um, and that's a great thing. You to be connected to a doctor who's growing, who's learning, who's
He's not static.
no,
That's
not at all.
it's the feeling you get knowing that you've got, I call it in your corner care. You've got someone in
Yes,
your corner health wise that
yes,
you can reach out to. And speaking of reaching out to, over the last several months, we've had COVID-19. I
sure,
call it a medical tsunami. It's been impacting care in multiple ways, in primary care especially.
sure.
How is that? How has the fact that you have direct primary care, did it change much? What happened during this time?
Well, Dr. Frago, I think we're up to 24, 25 bulletins post weekly, pretty much weekly, I think, emails and videos. And he has worked hard to stay current on the situation globally, nationally, and locally. Pass that information to us as patients, what's working, what's not working. He was very proactive in ensuring that his office wasn't a center of COVID, you know, spreading. So it was very proactive in getting, telemedicine quicker. He was already set up for it, basically. I'm sure there were other things he had to do. You'd have to talk to him and get his, like, exactly what they had to do from a patient perspective. It was very clear. This is how we're dealing with it. This is, if you have a need, this is how we're going to approach it. if I need to see you, this is how I'm going to see you. So it was very clear. It was comforting to me. Then his wife called and checked on us personally. How are you doing? Make sure we were okay. That's that's above and beyond the call of duty. And the thing I want to say as a patient, and I appreciated the doctor I listened to on your podcast earlier. Our doctors are human, and it's important. As a patient, I realized no doctor alive has ever been through a pandemic. This is a first. It's a first for us. It's a first for them. And the information is fluid, and it's so much out there. And I just appreciated Dr. Farrago sifting through the information and being honest. This is what we know. This is what we don't know. He was very, if you want to go technical, at times very technical about where there was research, where there wasn't research, and the different articles, that were coming out regarding different treatments for COVID. So it's been very helpful. At the same time, I really felt for him because so many of us now think we're COVID experts with our WebMD degrees. So no matter what he says or does, I'm sure he has a percentage of his patients are sending emails correcting him, and I can't imagine what it's like to be a doctor right now. So I want to be I want to be the patient he enjoys seeing. Yeah. Quite honestly.
It's funny you mentioned the videos, because I recall on my Twitter feed there are a number of doctors in the old system, and I really felt for them, because those doctors, they're primary care doctors, they have 2,000 to 3,000 patients.
Sure.
And they were exhausted at the end of the day with all the telemedicine calls they were doing.
Yes.
And so direct primary care doctors have anywhere from 500 to 800 patients.
Sure.
So their patient load is far lower. They don't have all 2,000 patients calling at once.
Exactly.
And they're
exactly.
They're able to manage that relationship, whereas the other doctors were just inundated. And I felt sorry for them, but I don't blame the doctors. I don't. And I've said this often enough in the show. I think, when you're in the old doctor's office, when you went to see them, you saw all those people and they were frenetic. They were dealing with a system that is.
Yes.
And it's terrible what's going on there. I also wanted to bring something up, and I read that, and I wrote it down. Well, I've got it on the screen. You create and implement safety and employee engagement programs. And that's your consulting practice. So in a nutshell, can you just unpack that? Because I think I have a dot that I want to connect here.
I'll take you back. Everything with me begins with a story. My childhood was different than most childhoods. I started going, I started going to work with my father when I was younger than 9, but my first real paid summer, I packed lumber. I was 9 years old. I got $1 an hour. And we have our hearing tested every year. I still have perfect hearing for my age, because my mother, this was before people paid attention in earplugs, she sent me to the sawmill with big protective, I think they were Norton earmuffs. And she said it was the hardest thing she did, sending her little boy with my dad to the sawmill. So my training was, don't do that, Eric, it can kill you. That my dad was military background mindset and very direct. And so I've grown up and worked in dangerous environments. And what I'm seeing and what I'm concerned about heading into the future is that more, especially after COVID, there's going to be more career changers. There's more people entering the workforce as baby boomers retire, and I grew up in a dangerous environment, so I know things to look for. And we're entering a whole new generation of employees who don't know what to look for in terms of danger. And it's not just age, it's career changers who are in their 50s who are transitioning and they don't know what to look for. And what we've done is we trust our safety program, which is largely sterile. And what I do is come in and take a sterile training program and make sure that all age groups and all learning styles can take that safety program and implement it. And a classic example I give is the role we ignore in safety training and culture. And the word culture gets used like, I want this culture, that culture. But I think of it more as an environment to make sure that you have story that goes with your policy, to make sure that you have it's communicated in a way that if you have you can't give a normal manual to a dyslexic employee and just something, it doesn't. And then repetition, the role of repetition in the safety environment, some people think it's demeaning, but actually there are jobs and environments that are so dangerous. One mistake is lethal. That's all it takes, one mistake. So there's certain jobs that happen in our environment that my dad, I don't care if you worked for him for 50 years and you tell him you're going to work on the chipper, he will say, make sure it's locked out and it's come to a complete stop before you open it. That's every employee every time. And so what I do is come in and make sure that we are creating that environment in your company. One of the saddest stories I know is it's a large online merchant in their warehouse department. They had a career changer, came in his 50s, had a background in marketing, moved up the ladder, showed mechanical aptitude, and was working on a lift truck. And that's required that the lift truck be elevated, the forks be elevated. I'm not sure in reading about it, they had a method, but the method was inadequate, obviously. But he didn't properly secure the forks. He was supposed to put a brace under the forks. He unhooked a hydraulic hose. Forks descended, crushed him, killed him. Oof. It's just tragic. And that's the type of job, one, that probably should have been a couple people involved. And two, it's the type of job where if you know him, whatever, we'll call him Joe, and you know Joe is going to work on that piece of machinery. Joe, every time he does it, every time, Joe makes sure the forks are properly secured. I would have taken that a step forward. I think there needs to be some sort of rack built. You take the forks up, you move the machine into the rack, you release pressure, take it a step further. But at least culturally, environmentally, every time, because that's a potentially lethal act. And it's something that we overlook because it's in a warehouse, and which should be a relatively safe environment.
Perception is safe, yeah.
Yeah. So that's a long answer to a short question.
No, but it's insight, because I can relate something here. I started connecting some dots. My dad always said, everything's related. The big problem is seeing the relationships. And
Sure.
So with direct primary care is better care. First of all, you have a doctor that's going to be listening to you. I use an example of a young carpenter who walks into his doctor's office and says, well, I'm going to be, I need a physical for a new job. And in the old system, the doctor would say, okay, fine, runs the test, out they go, clean bill of health. But in direct primary care, the odds go up that the doctor, your doctor, is going to say, wait a minute, what kind of job are you going to? You know, because there's a relationship.
Sure.
Tell me about the job.
Sure.
Oh, I'm going to be an iron worker. You
Sure.
mean like 300 feet up in the air? Yeah.
Yeah.
I wanted something interesting to do, you know, something more interesting. Okay, fine. Well, we need to have a discussion about your inner ear and the symptoms of an inner ear infection, because you can get dizzy like that, and that isn't good 300
Sure.
feet up. So
Yeah.
the other thing that I thought about was undiagnosed sleep apnea.
Yeah.
When you have, if you have a heavy case of sleep apnea and you're not getting enough sleep, at some point you're the equivalent of being inebriated. And if you're
Absolutely. Absolutely.
so you could make the case pretty easily that direct primary care enables a safer company. Just as an FYI, you're probably way ahead of me on that, but
yeah, and that's true, and that's interesting. Dr. Farrago, I was going through his website before our interview today, and he offers companies membership. So it's it makes us safer company. And one, like you mentioned, Dr. Farrago, with me, there are things. Our company was running 2 shifts and not getting enough sleep. And Dr. Farrago said, your numbers look better, but I can't fix your sleep problem. and he was quite honest about the health risk, you know, that my lack of sleep potentially shortening my life. So better get that fixed. And
yeah,
it's
there are some apps. There's an app. I'll have to put it in the description and send it to you. I have it on my, I think it's called SnoreLab. It's on my iPhone.
Yeah.
I'd need to put my glasses on, of course, but well, anyway, I think it's SnoreLab, but it records you snoring. And what will happen is if you have obstructive sleep apnea, you'll hear the sound of you choking. You stop breathing for 10, 20, 30 seconds. And then you gasp for air because your mind triggers a reaction in your gut and says, breathe, or you're going to die. So that's obstructive sleep apnea. But there's also central sleep apnea. I used to sell SleepLab sensors down here, so that's how I know about this stuff.
Oh, wow.
So you have central sleep apnea, which is a nervous situation. And there are a number of different things that you can do. You can do a home test, which measures both. I'd highly recommend that. And getting treatment these days is pretty easy. The gold standard right now is CPAP. And the key with CPAP is you have to have someone who really knows how to fit a mask, which I have a friend here who does. He's an artist at it and very good. But anyway, I would encourage you to have that checked out because it makes a world of difference. It really does.
Yeah. I'm sleeping pretty good now. With my case, it was more work schedule related. Although for your listeners, my mother, who died young at 59, had sleep apnea, and she passed away of a heart attack. And I'm not sure she used her CPAP machine like she should have. I don't know. I was obviously out of the house.
The newer machines have built-in telemetry, if you will, to see if you're actually playing by the rules. You've been at this point with direct primary care. You've had it since 2016, I think I read.
16, correct? Yes.
Dr. Samir Kamar, he's a direct primary care doctor, and he said the big problem DPC has in getting mass conversion to direct primary care is that most people don't understand what high impact primary care is and its benefits. And so I know it, you know it. What would you say to help those people who are hearing that for the first time from your vantage point as a patient? What would you say to them to help them understand what that high impact really means?
high impact is proactive. Most healthcare in the United States is reactive. I get sick, I go to the doctor. Um, and that's why I was going to the doctor once every year, sometimes once every 2 years. High impact is proactive. I am going to the doctor not because I'm sick, but because I'm healthy. I think I'm healthy and I want to stay healthy. And I want to live a long time and be active. I have visions, Lord willing, if I live in my 80s, I want to get on the floor and play with grandchildren and great grandchildren. I want to go out in the garden with them. I would love to be able to run at least a 5K or 10K with my grandchildren when I'm in my 80s. So I have this vision, and that's what high impact primary care is. It's about being healthy for the long haul. And I go to the doctor more than ever, and I don't go because I'm sick. I go because I'm healthy and I want to stay healthy.
There's, I guess one way of putting it, putting the membership in perspective. Have you ever heard of a gym a fitness gym that charges fee for service? In other words, a daily entrance fee. No, it's membership.
Yeah. It's membership.
There's a reason why. I mean, gyms are, it takes effort and it takes time, and I got to go to the gym today. And what do you mean? I got to pay every time I go? Come on. There's a disincentive that the system has.
Sure.
So direct primary care eliminates that or reduces that. But you also said you spend a little more on your primary care, which is not uncommon for some patients. Mm-hmm. Other patients, yes, they spend a little more on the membership, but what they save for medication costs, I'm truly amazed and shocked sometimes what people walk away. Right. Dr. Creighton Shute, one of the episodes, he said that he saved a patient $456 a month. She left the office in tears, happy. It's $5,000 plus a year she saved, more than paid for her membership. So there's this, the value here goes way beyond what people may think. They really do need to sit down with the physician and get the whole picture before making any decisions, because they're not getting all the facts if they don't do their research. Last question.
Sure.
I think this will be an easy one. Would you ever go back to the old system?
No, not at all. Not at all. And it's not, I mean, you love the people in the system. It's not a people. Great doctors, great nurses, great staff, some of the best people in our community. But it doesn't serve me. And just one, when you talk, going back to your previous question and comments, Dr. Farrago, when I needed tests or labs, they shop it around for me. So they tell me this is what this lab's charge and this is what this facility's charge. And so and then you mentioned one thing I'm on a very low dose cholesterol medicine, a statin. And Dr. Frey, the original bill for that, I think, was $600 for a 3-month supply. And I called Dr. Farrago, and he sent me to the website and the coupon, and I get it for $22 for a 3-month supply. So they're shopping for you. Because I mean, he cares about us, and I want to make that abundant. He cares about us, but a direct primary care doctor wants you to have money in your pocket to be able to pay your membership. I mean, that's part of the, and it's not, you can edit that out if you want, but the incentive is there. But that, my personal opinion is the direct primary care doctor I have does it because he cares about me. And so I think they just enjoy helping us find the best deal and the best services, because they're providing the best deal and the best services, and they want you to get it somewhere else too for whatever your needs.
Eric Brown, it's been a pleasure, and thanks for joining me today.
Well, thank you so much, Hunter. It's been great getting to know you, and I've enjoyed my time here.
Well, for winning healthcare food fights without the mess, I'm Hunter Schultz. Stay healthy, wash your hands a lot, and there you are.